Before you agree to your next medical test, especially after the age of 60, there's something you need to hear first. Because what I'm about to share could save you money, reduce unnecessary stress, and in some cases, even protect your health. Most people believe that more testing automatically means better care. It feels logical, right? The more you check, the safer you are. But here's the reality that very few people talk about openly. Not every test is always necessary. In fact, after 60, your body changes in ways that can actually make some routine tests less useful, sometimes even misleading. And when a test gives a confusing or borderline result, it often leads to more testing, more appointments, and sometimes treatments that you may not have needed in the first place. I've seen this happen again and again. A simple checkup turns into a chain reaction. One result leads to another scan, another opinion, another medication. And before you know it, you're dealing with anxiety, extra costs, and decisions that feel overwhelming. But here's what's important to understand. This is not about avoiding healthcare. It's not about ignoring your health or skipping important screenings. It's about being informed. It's about knowing which tests truly matter for your situation, and which ones you should at least pause and question before saying yes. Because after 60, your goal is not just to live longer, it's to live better. To avoid unnecessary procedures, to protect your peace of mind, and to focus on what actually improves your quality of life. And here's the good news. There are certain medical tests that many seniors are routinely offered, but depending on your health, history, and symptoms, may not always be needed as often as you think. In this video, we're going to go through 5 of these tests, one by one, in a simple, clear way. So before your next appointment, before you sign off on another test, stay with me. One of the most important things to understand after the age of 60 is that medical testing should become more personalized, not more automatic. Yet many people continue to follow the same routine they had in their 40s and 50s, agreeing to every test without stopping to ask whether it truly fits their current health situation. Over time, this habit can lead to what experts call overtesting, where the number of tests increases, but the actual benefit to your health does not. As your body ages, certain measurements and results naturally change. Blood values may shift slightly, imaging scans may show small abnormalities, and screenings may pick up findings that look concerning but are actually harmless. These are often called incidental findings, and they are very common in older adults. The problem is not the finding itself, but what happens next. Once something is detected, it often leads to more testing, follow-ups, and sometimes treatments that may not have been necessary. This is where the idea of risk versus benefit becomes very important. Every medical test has both. The benefit is what the test can detect or prevent. The risk can include false positives, unnecessary worry, additional procedures, and even exposure to radiation or side effects. After 60, the balance between these two factors can shift. A test that made perfect sense earlier in life may no longer offer the same level of benefit, especially if you are otherwise healthy and not experiencing symptoms. Another key issue is that many tests are designed to detect problems early, but not all early findings lead to serious disease. Some conditions grow so slowly that they may never affect your quality of life. However, once they are discovered, it can be difficult to ignore them. This can lead to treatments or interventions that bring their own risks without a clear improvement in overall health outcomes. What many people don't realize is that good healthcare is not about doing more. It's about doing what is necessary and meaningful for your specific situation. This requires communication with your doctor. Asking simple questions like, what is this test for? How will the results change my care? And what happens if I choose to wait? Can give you a clearer understanding of whether the test is truly needed. When you begin to approach testing with this mindset, you move from being a passive patient to an informed decision maker. You start to focus on what supports your long-term well-being instead of automatically following every recommendation without context. Another issue that becomes more common after 60 is the problem of false alarms in medical testing. These are results that appear abnormal or concerning at first, but later turn out to be harmless. While that may sound reassuring, the experience itself can be stressful and often leads to a chain of events that many people are not prepared for. When a test shows something unexpected, even if it is small or uncertain, it rarely stops there. Most of the time, your doctor will recommend additional tests to investigate further. This could mean more blood work, imaging scans, or even invasive procedures like biopsies. Each step is taken with caution, but the process can quickly become overwhelming, especially if you were feeling fine to begin with. The emotional impact of this is often underestimated. Waiting for results, hearing terms you don't fully understand, and imagining worst-case scenarios can create anxiety that affects your sleep, mood, and overall well-being. For many seniors, this stress becomes more difficult to manage, especially when it continues over weeks or months while follow-up tests are being done. There is also the physical side to consider. Some follow-up procedures are not completely risk-free. Even something as routine as a scan can involve exposure to radiation, and more invasive tests can carry risks of complications, discomfort, or recovery time. When these procedures are done to investigate something that may not have been a real problem in the first place, the benefit becomes less clear. Another important point is that not all abnormal results need immediate action. In many cases, doctors may recommend monitoring a finding over time instead of rushing into treatment. However, once a result is labeled as abnormal, it can be difficult for patients to feel comfortable with waiting. The natural reaction is to want to fix it right away, even when a careful watch-and-wait approach may be the safest option. This is why understanding the possibility of false positives is so important. It doesn't mean tests are bad or should be avoided completely, but it does mean that every result should be viewed in context. A single number or image does not tell the whole story. Your overall health, symptoms, and history matter just as much, if not more. When you are aware of this, you can approach testing with a calmer mindset. Instead of reacting out of fear, you can take a step back, ask questions, and understand what the result truly means before moving forward with more procedures. Another factor that becomes increasingly important after 60 is how your overall health, medical history, and personal priorities should guide decisions about testing. Not every test is meant for every person, and what may be helpful for one individual could be unnecessary or even burdensome for another. This is where the idea of individualized care becomes essential. As people age, they often develop different health conditions, take multiple medications, or have varying levels of physical strength and mobility. These differences change how the body responds to both tests and treatments. A screening that might be recommended for a younger, otherwise healthy person may not provide the same benefit for someone who already has other ongoing health concerns. In some cases, the risks or discomfort associated with testing may outweigh the potential advantage of finding something early. Another important consideration is life expectancy and quality of life. Some medical tests are designed to detect diseases that develop very slowly over many years. If a condition is unlikely to affect your health in the near future, discovering it early may not improve your overall well-being. However, once it is detected, it can still lead to additional testing or treatment, which may bring stress, side effects, or complications that impact your daily life. This is why many healthcare professionals emphasize the importance of shared decision-making. Instead of simply following a routine schedule, you and your doctor work together to decide what makes the most sense for your specific situation. This includes discussing your current health, your goals, your concerns, and how aggressive you want to be with testing and treatment. For some people, the priority may be early detection at all costs, while for others, it may be avoiding unnecessary procedures and focusing on comfort and independence. It's also important to recognize that guidelines for medical testing are often based on large groups of people, not individuals. They provide general recommendations, but they cannot account for every personal factor. This is why blindly following guidelines without considering your own circumstances can sometimes lead to overtesting or unnecessary interventions. When you begin to look at testing through this more personalized lens, you gain more control over your healthcare decisions. You are no longer just checking boxes on a standard list, but making thoughtful choices that align with your health status and what matters most to you. This approach can help reduce unnecessary stress, avoid procedures that may not provide real benefit, and keep the focus on maintaining a good quality of life. Another important factor to consider after 60 is how the risks of certain medical tests and procedures can quietly increase with age, even when the tests themselves seem routine. Many people assume that if a test is commonly recommended, it must be completely safe. But the reality is that your body responds differently as you get older, and even small interventions can carry more impact than they once did. For example, some imaging tests involve exposure to radiation. While a single scan may not seem significant, repeated exposure over time can add up, especially if those scans are done without a clear, necessary reason. In younger years, the body is often more resilient in handling these exposures, but after 60, the margin for unnecessary risk becomes smaller. There are also tests that require preparation or follow-up procedures that can be physically demanding. Fasting for long periods, taking strong medications to prepare the body, or undergoing sedation for certain screenings can be more difficult for older adults. These steps may lead to dehydration, weakness, or temporary imbalance, increasing the risk of falls or other complications that are rarely discussed beforehand. Invasive procedures bring another layer of concern. Even when done carefully, procedures like biopsies or exploratory tests can carry risks such as infection, bleeding, or delayed recovery. What might have been a minor inconvenience years ago can take longer to heal and may disrupt your routine more than expected. For someone who values independence and stability in daily life, this can have a noticeable effect. Another point that often goes unmentioned is how medications used during or after certain tests can interact with existing prescriptions. Many people over 60 are already managing multiple medications, and adding new ones, even temporarily, can sometimes create side effects or unexpected reactions. This is especially important when the original test may not have been urgently needed. All of this does not mean that medical testing is harmful or should be avoided. It simply highlights the importance of being selective and thoughtful. After 60, every decision about your health should weigh not just what can be found, but what it might cost your body in the process. The goal is to protect your overall well-being, not just to gather more information. When you begin to look at testing through this lens, you start to prioritize what truly matters. You focus on tests that have a clear purpose, a meaningful benefit, and a direct impact on your care. And you become more cautious about those that may add complexity without improving your quality of life. The final piece that truly changes how you approach medical testing after 60 is learning how to make confident, informed decisions instead of automatically saying yes to every recommendation. Many people grow up believing that the doctor makes all the decisions and the patient simply follows along. While trust in your doctor is important, your role becomes even more important as you get older because your health situation is unique and cannot be managed with a one-size-fits-all approach. Every test should have a clear purpose. It should answer a specific question or lead to a decision that improves your care. If a test is unlikely to change what happens next, then it's reasonable to pause and ask whether it is truly necessary right now. This doesn't mean refusing care. It means understanding the reason behind it. Simple questions can make a big difference, like asking what the test is looking for, how accurate it is, and what the next step would be depending on the result. Another important mindset shift is realizing that waiting is sometimes a valid and safe option. Not every situation requires immediate action. In many cases, especially when there are no strong symptoms, doctors may recommend monitoring over time instead of jumping into testing right away. This approach allows you to avoid unnecessary procedures while still keeping an eye on your health. However, many people feel uncomfortable with the idea of waiting because they associate action with safety. Learning to see careful observation as a form of care can help reduce that anxiety. It's also important to consider your personal priorities. After 60, health decisions are not just about adding years to life, but about maintaining comfort, independence, and peace of mind. A test that leads to stressful treatments or complications may not always align with your goals, especially if the potential benefit is small. This is where honest conversations with your healthcare provider become essential, so your care reflects what matters most to you. Having a trusted doctor who listens and explains things clearly can make this process much easier. When communication is open, you feel more comfortable asking questions and expressing concerns. You are no longer just following instructions, you are participating in your own care. This sense of control can reduce fear and help you make decisions with more clarity and confidence. Over time, this approach changes your entire experience with healthcare. Instead of feeling overwhelmed by appointments and recommendations, you begin to feel more grounded and informed. You know when to move forward, when to wait, and when to ask for more information. And that balance allows you to protect both your health and your quality of life in a way that feels right for you. Your health decisions after 60 are not just about doing more. They're about doing what truly matters. It's easy to assume that every test is necessary, that saying yes is always the safest option. But real safety comes from understanding, from knowing why something is being done, what it will change, and whether it actually improves your quality of life. Because after 60, your goal is not just to chase every possible problem. It's to protect your peace of mind, your independence, and your overall well-being. That doesn't mean avoiding doctors or ignoring your health. It means becoming more aware, more involved, and more confident in the choices you make. You have every right to ask questions. You have every right to understand your options. And you have every right to take a moment before agreeing to something that doesn't feel clear. The truth is, the best healthcare decisions are not rushed. They are thoughtful, they are informed, and they are aligned with what matters most to you. So the next time you're offered a test, pause for just a second. Ask yourself, do I understand why I need this? Will this result change what I do next? Is this helping me live better or just adding more worry? Because when you start asking the right questions, everything changes. You move from confusion to clarity, from fear to confidence, from simply following along to truly taking control of your health.